Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Each. So today we will be studying, you can say we will be discussing a case report on tibial fracture management by modified Thomas Splint. Today we will be having two case reports actually combined in one similar case of tibial fracture, and we will also learn that how you can make a modified Thomas Splint for small animals. You can make it for dog, cat and sheep, goat. Okay, that much. For large animal it is a different principle, but if you will go through this video you can learn for the small animals how to make the Thomas Splint. Let us go to the case report. Before there are some formalities, okay, you know it. So there are three case reports. These two are little bit old, which I have the healing photographs of these two, but this is a very recent one. The day I am recording the video, it is only 14 days old. Okay, the case is 14 days old, so I don't have the healing picture, but for these two I have the healing picture. We will see how Thomas Splint can be helpful in field condition. Whatever I am teaching in this case report is applied for field condition. If you are staying in a city where you will find multi-specialty hospitals, or you can say you can find some private hospitals which you have an orthopedic surgeon, this may not be applicable. But in field condition, you know, there are many lacunas. Okay, we will not get into that in detail, but you should know that under field condition how we can manage the tibial fracture. Okay, so these three are the cases. So the first case, you can see here, this is a fracture of tibia. Here you can say this is fracture of tibia, fibula is intact. There isn't any fracture of fibula. This is a case 2. Here both the tibia and the fibula has been fractured. These two cases which I have the X-ray photographs, when I was posted few months back in a district veterinary hospital, I had access to X-ray, but now where I been posted in a village level, I don't have X-ray pictures, but by physical palpation you can know there will be fracture, but I may not able to tell you that which bones are fractured. Mostly it will be the tibial, the bigger bone is tibial. So this 1, 2, this is third. Here it is a fracture. Look on the right, tibial fracture. That is why there is tilting or the kinking of the limb. Okay, there was swelling also, which due to the animal is black, so you may not appreciate the swelling, but there was swelling. So this was the case, the tibial fracture. So what we did? We did, or I did. The surgery is usually a teamwork. It is never a single person's work. So I prefer telling that we, not I. So we did the Thomas Splint. Here you can say this Thomas Splint, the bars of Thomas Splint. I don't have the pictures, exact pictures of this case. This was actually GSD puppy. All the cases are of puppies. Usually they are very playful in nature, the puppies, so they may get into some accident with vehicles, or sometimes they jump up from the bed and get their bones fractured. This was GSD puppy. This was mixed lab actually. The picture is here, the mixed lab, and this one is a nondescript actually in depot. Okay, so here you can say I have applied the Thomas Splint. Here also this is Thomas Splint, and here the picture of Thomas Splint. This is the Thomas Splint, and here also you can say this Thomas Splint. I will discuss how the this is Robert Jones bandaging over the Thomas Splint. Here I only use the adhesive tape. I will discuss in detail how the padding is done, what are the things you need to do. So you should know all these cases has been managed by Thomas Splint. Okay, now we will know that what are the materials required for the Thomas Splint. First of all, GI wire, or you can use aluminum wire. Aluminum wire, you can say it is easily pliable, so GI wire works best, but if you do not have, you can use aluminum wire. The diameter is nearly you can use from 1.5 mm to 3 mm. For large dogs also 3 mm is sufficient enough, or you may go up to 3.5, but beyond that it is not needed for small animals, even for sheep and goats. Okay, for cats you can go up to 1 mm. Okay, small cats, or you can say also you can use for rabbits also, you can go for 1 mm, but this is the range. But with experience you will know that in which animals how much thickness of GI wire you need. So it is only purely based on the experience. You can't tell that for this animal it is required 2 mm. Okay, you have to see the body weight of the animal, the configuration of animal, then you will decide the size. Only remember that the size range 1.5 to 3 mm, so that you can prescribe like that. Bring this from the hardware store. Adhesive tape, usually in the brand name, I don't like to discuss the brand name, but you should know some Leucoplast adhesive tape or Chemiplast. Okay, there are different brand names. Okay, these two which I usually use, this is very common, and the sizes are half inch, 1 inch, 2 inch. Okay, you can recommend on the basis of size of the animal. Next, cotton roll, you know this gauze roll, which is 4 inch and 6 inch, usually available in the even at the village level. If you want a 2 inch, it may not be available. You can simply cut down the 4 inch by blade to make it 2 inch, or you can say if you want to use 1 inch, then simply by blade you can cut into different sizes and you can use them. Antiseptic powder, this powder is necessary if you are using Robert Jones bandaging. Here you see this is Robert Jones bandaging, or you can say modified Robert Jones bandaging. When you use this one, you need to have antiseptic powder underneath, because you see in this, when I am using only adhesive tape, there is enough space for air. Okay, if there will be sweating, if by evaporation moisture can be drained out. But here, when you are completely covering by the Robert Jones bandage, there will be accumulation of moisture over time. So the moisture can further attract bacteria or microbes. So if you will pour these antiseptic powders, mostly povidone iodine powder, or you can use any antiseptic powder that is available in the in your area. Sometimes some veterinary dispensary, herbal dry dressing powder are also available that you can use. So when you will apply those powders here, what will happen? They will absorb the moisture. When you will be changing the dressing after 7 days, or you can say 3 to 4 days even, the animals may mutilate this bandage. You have to reapply. So when you will be reapplying this Robert Jones bandage, also you have to reapply the powder. Okay, that is the function of powder. Being antiseptic, it will not give chance the bacteria to grow, and also it will absorb all the moisture that has been produced by sweating. Okay, so antiseptic powder and pliers is needed for the bending of the GI wires. Okay, so these are the things required. Now the Thomas splint is best for tibial fracture. Okay, this is best for tibial fracture. In field condition, we don't have any orthopedic surgeons or any orthopedic instruments also. Those who are doing pinning, at least pinning in field level, it is because of their sheer will and I can say their sheer interest. Okay, it is not that anyone is providing them facilities, it is because of their interest and because of their willpower. Okay, so it is best for tibial fracture, and also you can use for mid-shaft femur fracture. Okay, if you are suspecting the mid-shaft femur fracture, this also can be used for the immobilization. Okay, the principle of fracture management is immobilization. You see, for femur fracture, I usually recommend you should go for the internal immobilization as well as external immobilization. This is for the best result. Okay, there are different types of internal immobilization. You can go for pinning. Pinning may be intramedullary pin. Intramedullary pinning may be single pin, stack pin, cross pin. There are many more things. And you can go for plating, among which the most famous one, dynamic compression plating. Then wiring, screwing. These are internal type. Under external, you can do bandaging. Most famous one is the modified Robert Jones bandaging, and you can use cast. Cast may be of plaster of Paris or fiberglass. It may be half cast, full cast. Okay, then splint. Under splint, it comes modified Thomas splint comes under splint. Okay, now ESF, external skeletal fixator. It may be linear or it may be surface. There are different. Orthopedic is a very big chapter and it has vast knowledge. Okay, you can't keep this confined to these in a single video. Just for the knowledge, I am telling that there are many things in orthopedic which can be tried, but in field level nothing is available except for external immobilization. That too bandaging, cast and a splint, not even ESF. Okay, for ESF also you need Steinman pins. So these three is our weapons. Among them we are discussing only the splint, but for remember it is best for tibial fracture. I don't recommend for femur fracture, but in field, you know, we don't have many options. Sometimes the farmers can afford to go to the nearest private hospital or nearest even if our to colleges where the facilities are available, so you have to do the Thomas splint. So remember, for femur fracture, for tibial fracture, why I told mid-shaft fracture, because if it is a distal end fracture or the proximal end fracture of femur, it will be very difficult to oppose them. Okay, when you will be pulling the limb, it may not get exactly opposed. Okay, that is why I don't recommend for the proximal and distal fracture, but for mid-shaft femur fracture you can go for the Thomas splint. Okay, now let us go to the preparation. First of all, you need to make a ring. Okay, this is the important ring. This ring should include the point of hip and the pin bone. Here, see, this is point of hip and here will be pin bone. This ring should completely cover these two points. You see, the making a ring isn't an easy thing. Okay, but it is not also a difficult thing. With experience, you will know how much ring you should be making. For example, if you are smart enough, okay, you can measure by this using your thumb and index. Simply put this right hand under the thigh and this one on the upper side, that is on hip, and you can measure this ring structure. For small animals it's alright, you can measure this thing, or you can at least have a imagination, or you can say you can view what should be the ring size. Okay, but this ring, the exact ring, is a very experienced process. When you will do more and more cases, you will know how much exactly the diameter of the ring should be. Okay, but you don't need to worry. When you are going for a first or second case, it may be a large or it may be a small, but you can adjust. Okay, you can adjust by padding. I will discuss how padding is. So this is the ring size which I determined in that particular case. So after the ring size is determined, you have to bend these rods, usually 1.5 meter, or you can say for a little bit less than 7 kg or 8 kg, 1 meter rod GI wire is sufficient enough to make whole Thomas splint. Okay, so this is the ring. You can see here these are limbs. In the earlier Thomas splints, simply by bending here, it is Thomas splint. But in modified, you have to make it in the shape, or you have to adjust along the contour of the limb. We'll discuss. Okay. So first you have made the ring, then tape it. Okay. This taping will prevent any movement between these two rings. You see, this is outer inner, not exactly outer inner. You have to make a ring which may deviate. So you have to apply the tapes here. Concept tapes. Another important thing is bending of the ring. Okay, this inner angle, this one, put it on a table and simply bend it. Okay, why bending is necessary? See here. See here. If I will not bend this one towards the abdomen, okay, then the ring will be straight one. And imagine like this. This is the abdomen. Okay, and here is your ring, and here will be femur bone. When the animal will try to abduct. Abduct means towards the abdomen. If try to abduct the limb, it will act as a fulcrum, and it will put pressure on this femur bone. Okay, so when it will put pressure on the femur, it will cause pain in animals. Suppose there is femur fracture, what you will do? So it is better you have to slightly bend it towards the abdomen, so that ring will rest on the abdomen and it will not put pressure on the limb itself. Okay, you understood the concept, why you need to bend this. Usually in books you will find the recommendation it should be 45-degree angle. Okay, And in some literatures also, here I have bent the ring itself, but in many books or many literatures you may find the ring will be straight. Here the ring will be straight, this frame will be bent. Simply ring will be straight, but the frame will be bent. Okay, whatever you do, no problem. Okay, so you know how you have to bend the frame by 45 degree. This is a rough frame. Then comes the padding. Okay, this is padding. You can apply cotton. This is the best thing for padding. Then apply the gauze. You have to first layer of gauze should be little loose. Then you have to tight so that a thick padding here you can say a uniform and thick padding should be there. See, padding can be of full ring. Here, see in this above picture, here the padding is full ring. But in many of the articles also and many of the videos, if you search in YouTube, you may find 2/3 padding. Here this is 2/3 padding. 2/3 of the ring is padded because this upper portion usually rarely comes in touch with the body. So you may not need padding of that part. But you see in different parts of India, you may find different followers or different techniques. But in some parts also, I have gone to some, I think Madras Veterinary College, there a surgeon did half padding, only up to this line, half padding. So you choose according to your convenience, and when you see in half padding you are getting good results, then go for it. Whatever you do, the principle is you should provide padding especially on the abdomen side, where the frame actually rests, or you can say frame actually touches the body. There should be a padding so that there won't be any injury that can be caused by this iron rod. Okay, now the padding part is over. Okay, you have done the padding. After doing the padding, simply apply it to the limb, the affected limb, so that you see limb is like this. Okay, apply it to the animal. After applying, you have to bend this one, you have to contour it, you have to apply pressure here so that rod can be like this. Then you have to apply pressure here, it can pop up. Then you have to apply pressure towards the limb so that it can come like this. So you have to bend this one so that this iron rod comes in conformation with the limb, whether the hind limb, or you can say for the forelimb. For forelimb, it can be managed up to the radioulnar fracture. Okay, for femur fracture, we should go for internal as well as external. But in field, if you are not having anything, go for the Thomas Splint. Okay, there also same principle applies. Okay, so you have to bend it towards its conformation. Now after bending it into the conformation, where to bend? Okay, you have to bend to make a splint. So you have to go for the longest digit, last digit which will be longest. Up to that you have to measure and you have to make the bending. Here you can say up to that length you have to make the bending. Why? You see, when there will be fracture, the muscles will be in contracted stage. Okay, some surgeons prefer to make the length up to the you can say digital pad. Here our is palm. In dogs and cats you will find the up to digital pad. But what happens when the dogs or cats are presented to the veterinary dispensary, you will find they are in extreme pain and the muscles will be in contracted stage. So when you will be pulling the limb, when it will reach the maximum, still after 1 to 3 days when you will be applying the Thomas Splint, muscles will get relaxed. Okay, there will not be any pain. When the bones are perfectly aligned, the pain will be minimum. So the muscles will start to relax and the limb usually gets slightly bigger. Okay, if you have taken up to this length, that is the up to digit length, then after some days, usually after 7 to 14 days, or you can say 7 to 8 days, when you will doing the fast bandage change, you will find the limb slightly elongated. Doesn't mean limb has grown, it simply means that the limb, the muscles has been relaxed. So if you have taken up to the digit length, then after some days it may come up to the digital pad length. Okay, understood why you should go for to the digit length. Okay, so you have made this, so you have made this ring now complete. Okay, now here you can see I have applied some leucoplast here and there. You can say at a distance I have applied some leucoplast. Why this adhesive tape has been applied? It gives anchoring point. Okay, if you are doing Robert Jones bandage or you are doing simply adhesive tape bandaging, it needs some anchoring point. Okay, in iron rod the bandage may slip, but if you provide some anchoring points, it will slip. When the animal will be playing, will be moving or running, the bandage will slip. But in this configuration, it may slip very less amount, or you can say it will slip less than there won't be any anchoring point. Okay, so you have to provide these anchoring points. Okay, these are the anchoring points. You see from side view, here this is the bending which will rest on the abdomen, and you can see here the rod. Okay, now you have to apply to the animal. Here this is one type of, this is Robert Jones bandaging, I already told, and this is simply tape bandaging. So there are different techniques. One more thing, some surgeons or in some articles, here you can say it is a very steep bending, or you can say this length is very less, because we are confirming the iron rod to the digit, or you can say to the distal part of the limb. In some articles or by some surgeons, they prefer it to be nearly vertical, or you can say like this. Okay, why? You see the advantage of this, that you might be knowing from simple physics, if here is a pillar and above here there is tension applied, and you can say that, you see in bridges you will find a very thin pole, or you can say column, and you can say there is a very thick base. I don't know exact the physical term or the civil engineering term, just imagine how they are placed. Why they are placed? Because all the tension coming here, they can be distributed. Okay, if you are elongating this base, then it can easily be shifted, and less pressure will be there on in column itself. Okay, so here the same principle is applied. Okay, if I am making this one is steep, there is very less surface area which is in contact with the ground. There will be much tension on the iron rod. If you are using proper thickness of iron rod or GI wire, you may not find any problem. But you see this small physics, I thought you should know, because in many parts when you will go, they usually perform a square type, so that maximum part will be in touch of the ground and maximum tension can be relieved easily. Okay, now the application. So you have to apply first. You see one thing, when you will be applying this Thomas splint into the limb, here you have to put an assistant who will be pulling this Thomas splint, and here one assistant pulling this limb. Okay, pulling this limb is known as traction, and pulling this frame is known as counter traction. By this you can make this limb straight. It should not be too straight. If you are making too straight, this limb will be longer than this one. Okay, so it should not be too straight, it should be just straight. Okay, so when you will be using counter traction, what we will do after that? For this adhesive tape type bandaging, there are many techniques through which this distal part of the limb can be anchored to this ring. Okay, so let us understand how they are done. Suppose this is the limb, okay, and this is the rod, and if you will view from this side, from the front, okay, this will be the limb, okay, and this will be the rod, single limb. First technique is you simply apply a tape go through around and to the opposite side. For scientific talk, you start from the lateral side of the limb, then go through the ring and end in the medial side. Here how this start from the lateral side and through the ring you can go to the medial side. Okay, now to strengthen this one you can apply tape here. Okay, like this, including the iron frame. This is one technique. Another technique is, okay, so another technique is in books. If you will follow the small animal surgery by person, in that technique what they do, they will apply a tape in the lateral side and they will anchor it to the frame itself. Okay, you see here they will apply on the lateral side and they will anchor into the frame itself to the proximal part. Okay, then they will apply another tape to the medial side, to the opposite side. Okay, to the medial side. Then they will anchor to the distal part of the frame, or you can say this is anterior, this is posterior part of the frame. Here you can see from the medial side. From the medial side they will anchor into the frame. Understood how they are done? Then they will be doing the taping to reinforcement of this first tape, reinforcing the first tape. These are two techniques basically used to anchor this limb into this iron frame, especially the distal part. Then you can simply apply some tapes. Okay, here what I have done, you see these tapes. See these tapes. You can say to one side it has not been included in iron frame. Okay, I am applying simply tractions. Okay, traction and counter traction. Here I have taped to this limb. Here I have taped to that limb, so that it can, the limb, there will be greater immobilization, not greater exactly, but there will be more chances of immobilization, or you can say more degree of immobilization. Okay, here and also here. Okay, these three I usually place, one above the fracture line, one on the fracture line, and one below the fracture line. Okay, so I do like this, but you can do on your own, or you can simply put all the tapes by including the frames and you can simply close it. Usually give some spaces between them for the movement of air. And also remember, when you will be doing this taping, the animal will come after 3 to 4 days because these tapes get loose. But don't worry, have patience and do the taping. Okay, and here what usually is being done, this is Robert Jones bandaging. Okay, here what we will do, this is the frame. Okay, on the frame itself you first apply bandage. Okay, when you will apply bandage, then you apply into the animal. On this bandage the limb will be there. Okay, on this bandage limb will be there. Then you can apply tape to this Thomas splint, or you can simply do the Robert Jones bandaging including this Thomas splint and the limb. Okay, simply as this one. This is Robert Jones bandaging, where you will do the bandaging. Don't forget to apply the povidone iodine powder, okay, or any antiseptic powder that is available to absorb the moisture and retard the growth of the bacteria. So these are two types of bandaging that you can try. In southern parts, I have attended some conferences in Tirupati also, Chennai also. They prefer this method. Okay, but in our colleges in Odisha, we prefer this method, but both are equally efficient, does not cause a problem. Thing is, you should have a patience while dealing with the orthopedic patients. You need to have some patience because there will be some complications. In field level, at least there will be complications. Okay, next, this is the most important thing in a pain management, the tibial fracture management, any orthopedic fracture management, that is pain management. This is very important, pain management. Many a times people forget how painful the fracture is. Those who have the fracture, they know how painful it is. I only had a sprain on my collarbone and it was very painful. And remember, what about the fracture? So you should give opioids. Many a times we give NSAIDs. NSAIDs do not have that power. If I have a special lecture for opioids also and NSAIDs also under the playlist anesthesiology. I will give the link in the description. You can check them out. Okay, opioids are very powerful painkillers and very good painkillers. Okay, so under field condition you may find tramadol easily, because in many of the public health centers, or you can say community health centers, tramadol is used. You may find tramadol, but you also can use butorphanol. Butorphanol is better than tramadol, I think. I have used both of them, butorphanol, tramadol. I found butorphanol to be much superior than tramadol. And also remember, in butorphanol, when you will be giving butorphanol, you may find some degree of depression. Okay, but in tramadol you may not find this depression. Okay, so I suggest you should use opioids, at least use tramadol, which is usually available from the second day onwards. And one more thing, when you will be giving opioids, give it before applying the Thomas Splint. Okay, so that when you will be applying Thomas Splint, there will be certain degree of analgesia. Okay, after that you can maintain up to NSAIDs. You may give meloxicam or carprofen, and usually give it for 2 to 3 days, not more than that. There is a debate regarding this one, whether the inflammation is necessary for the bone healing or not. Don't go into that. Simply give for 2 to 3 days. You see, when the bone will be perfectly aligned, or you can say in certain degree of alignment, there will be less pain. Pain persists when the bone fragments are not exactly aligned. They will pinch the nearest nerves or nearest muscles. Then there will be pain. If it is perfectly aligned, it will not cause much of a pain. Okay, so pain management is very important. Okay, and this is the healing picture of the first 2 cases. I told you third one is a very recent one, and also we don't have X-ray facility in the village area. Now here you can see this callus formation. You see, when you will be using the Thomas Splint, you will find a very thick callus. You see, this is also a very thick callus, and this is also very thick callus. You can understand by the example. Suppose there is a cut, there is a skin wound, and you have not done the exact apposition by suturing. There is some gap. I told you it will heal by granulation. There is a wound class. If you have not watched, go to the principle of surgery, you will see. So there will be granulation. Granulation is a very thick tissue, and you will find that area to be much thicker. If you will oppose it by sutures, there will be less granular tissue and less scar formation. Bone heals same way. It just takes slightly bit more time than skin or soft tissue, but it heals with same principle. The main principle behind the internal immobilization, like the plating and the dynamic compression plating or IMP. Okay, so the main principle is that it should be exactly aligned, so that there will not be any, it should heal with minimum callus formation. Okay, here you can say very thick callus. This is a very thick callus, this is a very thick callus. But thing is, in field you don't have any things. You don't have any modern infrastructure facility. Also sometimes farmers are, you see, if you go for the IM pinning or plating, the operation cost is high. Okay, so the poor farmers, which he or she is keeping a dog for companionship, he or she might not be so capable to afford those surgeries. So you can use this Thomas Splint. You see, this callus formation is not a big problem. The animal will bear weight and will live freely. If it is a puppy, especially puppies, this will get remodeled. With time, it will get remodeled, and the animal will not have any problem. He or she can live happily. In adults, may cause some problems, some limping may be there, but the thing is, the animal will live. The owner will be happy. Okay, so now there is nothing more pleasurable than owner's happiness and especially the animal's happiness. Okay, so these are the things which you should know about Thomas Splint, and this is also a case report. Along with I discussed how these things happen. This is actually 30 days post-op, and this one took a little bit more time. This was 37 days post-op. Okay, because you see here both the bones are fractured and the owner was a little bit of careless. for this one, this was a mixed Labrador puppy. This was GSD pup. The owner took very good care, and the animal born. We removed the splint on 27 days actually. After 3 days, he produced the X-ray, and this was the callus formation. The animal was bearing the weight. Okay, so this is all about today. The most important part which you learned in this lecture is how to make the Thomas splint. So we will meet in the next class or case report or anything. Till then, tata, bye bye, take care.